Hi, my name is Macy. I work with social services here. I was coming to talk to you. Your doctor requested for me to come in and see how you're doing. The doctor mentioned that you lost your mother a few months ago and that you've been having feelings of sadness, not really having the desire to get out and get out of bed. So I wanted to kind of come in and introduce myself and see how you're doing today.
Yeah, I was talking to the doctor about that. I have just felt really depressed and sad, and I don't really feel like being around people. I would rather just be by myself at my house, and I'm perfectly fine there. Um, I have a really difficult time going to work because I really don't want to have to deal with people or be around people. Um, but I did decide to go and talk to the doctor because I'm having a really difficult time sleeping and I don't have much of an appetite. Um, but I felt like, I know it's been a few months, but I feel like this is pretty normal since I lost my mother. But some of my friends are worried about me and told me I should come talk to somebody. Although I don't really care to be around people and I'm perfectly fine at my house. But
Yeah, so I definitely think that what you're feeling is definitely the grieving process, and everybody grieves differently. And what we'll try to do here is help you to stay safe, to stay healthy, even though you're going through that grieving process. And that's what I'm here to help you with. So if you're okay with it, today I'd like to do a few assessments with you so I can kind of see where you're at so then we kind of know what direction we need to go in the next few times that I see you. Is that okay?
yeah, that's fine.
Okay. So the first assessment that I'm going to do, I will just ask you a few questions, and you will tell me over the past 2 weeks how often you have been bothered by any of these following problems. And I'll go through them slowly because there are several answers, and you can answer to your best of ability. If you have any questions about them, please just let me know. If you would like to stop, that's okay too.
Okay.
Okay. So what this is a depression scale to just determine um, kind of where you are at on this scale. So I will ask you the questions. And again, ask me if you have any questions, you can stop me and let me know.
Okay.
Okay. So over the past 2 weeks, how often have you been bothered by, had little interest or pleasure in doing things?
Um, Nearly every day.
Okay. Okay. In the past 2 weeks, have you had any feelings of being down, depressed, or hopeless? Um, Not at all. Several days, more than half the days, nearly every day.
Um, More than half the days.
Okay. Okay. In the past 2 weeks, have you had any trouble falling asleep, staying asleep, or sleeping too much? Would you say not at all? Several days, more than half the days, or nearly every day?
Nearly every day.
In the past 2 weeks, have you been feeling tired or having little energy?
I'd say every day.
Okay, nearly every day. Okay. Over the past 2 weeks, have you had a poor appetite or overeating?
Um, Almost every day. More
Every
than,
day you don't have an appetite?
um, I have a poor appetite. Yeah, I just don't feel very hungry most days.
Okay. Okay. In the past 2 weeks, have you been feeling bad about yourself or that you're a failure or you have let yourself or your family down?
Um, no, not any of that.
Okay. Over the past 2 weeks, would you say you've had trouble concentrating on things such as reading the newspaper or watching television?
Yeah, I'd say nearly every day.
Okay. Okay. Over the past 2 weeks, have you noticed that you've been moving or speaking so slowly that other people could have noticed? Or the opposite, being fidgety or restless, that you have been moving around a lot more than usual?
I'd say several days. Yeah.
Okay. Okay. In the past 2 weeks, have you had thoughts that you would be better off dead or of hurting yourself in some way?
Yeah, I'd say more than half the days.
Okay. Okay. And then the last question, it says, if you've checked off any of the problems, how difficult have those problems made it for you to do your work, take care of things at home, or get along with other people? Would you say not difficult at all, somewhat difficult, very difficult, extremely difficult?
Extremely difficult.
Okay. Well, we will definitely talk about where you are at on this depression scale next week when I see you, to kind of discuss where you're at and how we need to move forward. Does that sound okay?
Yes. Yeah.
Well, I also want to do another assessment with you, um, just to make sure that your safety at home, and it's a routine questionnaire that I give to patients that are having depression, and I just want to make sure that we cover all of our bases before you go today.
Okay.
So this assessment is made up of 4 questions. So I'll ask you the questions and then I'll tell you what the answers could be. And you just answer to the best of your ability.
Okay.
Okay. The first question is, have you ever thought about or attempted to kill yourself?
Um, I would say it was a passing thought.
Okay. And how often have you thought about killing yourself in the past year?
Um, uh, Sometimes.
Okay. So you would say 2 times in the past year?
Yeah.
Okay. Have you ever told someone that you were going to commit suicide or that you might do it?
No.
No? Okay. And the last question is, how likely is it that you will attempt suicide someday? Would you say never, no chance at all, rather unlikely, unlikely, likely, rather than likely, or very likely?
Um, Rather unlikely.
Okay. Okay. Well, what that assessment was to determine, it's a suicide behaviors assessment, to determine where you are, if you were having any thoughts of suicide, to see if we needed to move further with that. So next week we will discuss this more. It definitely will give us some topics to talk about, and it helps us to measure kind of where you are today. And then as we go through sessions, we can do this again so that we can see where you're at and how helpful our sessions are together. So I will see you again next week.
Okay. Thank you.